Good morning, all the second year students. Today we will discuss the factor modifying drug action. The many factor modifying the effect of drug. The factor may modify the drug action, qualitative and the quantitative. Qualitatively or quantitatively. The many factors modifying the drug actions, qualitative and the quantitatively. Therefore, adjustments of dose may be required to bring about the desired effect with least unwanted effect. The important factor that modify drug effect and influence the therapeutic dose of the drug. Now so many factors are there, but the first factor is most important. Age factor is most important because of newborn baby infants, children, young people, then old age people. Now three category of the newborn baby, infants, and the children up to the 10 years. Liver not mature, not developed, or not mature, and the drug effect is different than the youngster, because youngster having the liver is developed and the mature. All type of the drug effect is produced. An old age person, their metabolism is slow, absorption is slow, decrease the glomerular rate of filtration, and there that's why the age is so important. Generally, the age, the dose for the children, the dose calculated for child from adult dose by different formulae. Now, first formula is Young formula. child dose is equal to the ratio between age in year into adult dose divided by age plus 12. That is a Young's formula. Again, see the Young's formula for the children's dose. Calculate the ratio between age in year into adult dose divided by age plus 12. That's the factor. Second formula is Dilling's formula. Dilling's formula. The child dose, the ratio between age in year into adult dose divided by 20. Next, third formula, that's the Clark's formula. The child dose is equal to weight in pound, LP, into adult dose divided by 150. Last formula is body surface area. Child dose is equal to surface area meter square into adult dose divided by 1.7. Now the body surface charts is available. Generally you went in the clinics, in the waiting room, the chart is, every doctor, the chart is display on their board inside the notice board. Yeah, their informative boards, they are having that charts. For example, your age, your weight, age into body height, age, calculate the age. Some formula is different, some formula as per your height. For example, 5.5 your height to plus 10 is weight. Maximum weight should be the 65. That the charts is available. Like the charts is available, the age factor is more important role play in the old age people. That is older people, old age people, elderly peoples commonly. That is absorption rate is decreased, intestinal motility of gut should be the low, then metabolism rate should be the low, absorption rate should be low, renal excretion rate is low. That is the age factor is most important. That's why age is always considered to given the dose. What do you mean by the dose? Now age, dose is, drug dose is depend on the age. Dose is given. What is the dose? Dose is appropriate quantity of drug required to produce certain degree of response in a patient. Dose is given to the appropriate quantity. It should be given the appropriate quantity of drug. And that produce the certain response to the patient, produce the desired effect. For example, aspirin is commonly used as headache, you know the headache, sar dard, doko dukhna, pains. Generally dose should be given 300 to 600 mg. While it acts as anti-inflammatory, dose for rheumatic arthritis, it is given by 3 to 6 gram per day. That's a variation of the dose as per the age. Okay. Now next factor, second factor. The first age, second factor is sex. Is most important role. Due to the more adipose tissue, more adipose tissue, the drug metabolism is slow in the female, and they having the lower weight. They having the lower weight. When drug is given, they causing the pelvic congestion. The female, such as cathartics, are to be avoided during pregnancy, menstruation, the period of the female, that should be avoided, and lactation, it should be avoided. For another example, drug like the antimetabolites and the antimetabolites drug, cancer drug, antithyroid drug, it should be avoided in the pregnancy. But antimetabolites and the thyroid drugs avoided in the pregnancy. That's it. Anti-thyroid drug, anti-metabolites is avoided the pregnancy. See again the sex factor. Due to the more adipose tissue in the female, drug metabolism is slow, and hence they having the low molecular weight. When the drug is administered due to the pelvic congestion, such as cathartics, are drug avoided in the pregnancy, menstruation period, and the lactations. And the drug like antithyroid drugs and the antimetabolic drugs always should be avoided in the pregnancy. The next factor, these are the important, all the factors are important, always asked in the annual examination, the board. The next factor should be number 3, route of administration. The some drug like insulin, see the, you know the drug insulin, adrenaline, this drug given orally, it is inactive, it is not produce any effect by orally. But this drug given parenterally, but this does given parenteral routes, these are active. Another example, magnesium sulfate is given orally and is act as saline cathartics. Magnesium sulfate, if is given intravenous route, it causes CNS depression. This causes CNS depressions. That's why route of admission is so important factors for the drug administrations. Now, these are the two examples. Some drug like insulin and the adrenaline is orally is totally inactive, but it can be given by parenteral routes. It is active and it's produce the desired effect. Another example of that, magnesium sulfate is given orally, it acts as a saline cathartics. Good, but magnesium sulfate is given the intravenous, that is parenteral intravenous route. That is intravenous route. It caused by directly CNS depression. That's why this route should not used by parenterally, not used. It's given by this orally. That's why the route of administration factor is most important. Thus, the route of administration can be alter the effect of the drug. Okay. Now the next factor, the rate of absorption. Metabolism and excretion. Now in that route, the drug is absorption, metabolism, excretion take place in the body, but all drug effect not is the same rate. So many drugs having the different rate, metabolism and excretion. For example, streptomycin. This drug is act as a tuberculosis. Is given to the act as a tuberculosis. Generally, this drug is not absorbed orally, not absorbed from GIT, gastrointestinal tract, and cannot produce the systemic effect. Drug should not reaches in the blood. Systemic effect. Okay. Drug which are absorbed from the stomach have the rapid action, and thus the absorption from large intestine is slow. See, the drug are absorbed from stomach. They having the onset of action is the rapid onset of action, and then absorb from the then large intestine slow action. The drug acetylcholine, it is not. Drug like acetylcholine is rapidly metabolized, cannot be used clinically. Acetylcholine. Acetylcholine denoted as ACH. Acetylcholine. Rapidly metabolize. Very rapidly, but not use clinically. That is C, clinically. Further depending, depending on the rate of absorption, metabolism and drug excretion, drug have to be given once, twice, thrice in a day. The drug have given one time in a day, two time in a day, or three time in a day, because they maintain the optimum concentration in the blood, in that factors. Okay, now the last factor today, pathological factor. The several diseases can influence the drug action and the drug depositions. Some are effective only when the disease is present. Example, aspirin lower the rise body temperature in fever, tap. Aspirin act as an antipyretic, is lower the rise in body temperature up to the normal body temperature. If does not reduce normal body temperature. Okay. Similarly, iron is better absorption in the iron. Iron is present in where? Hemoglobin. The iron is most important part in the anemia, maintain the hemoglobin level in the body. Similarly, iron is better absorbed in the treatment of anemia. Okay, that is the pathological. GIT disease, gastrointestinal tract disease, can alter the absorption orally administration of drug, and the liver disease can influence the disposable in the several way. Kidney disease can alter the rate of excretion and the actions, okay, of the drug. Now the last factor, so easy factor, time of administration. Drug is administered as per therapeutic use when the some drug are seen as depressant. These are always administered at night. For example, sedative and hypnotic drugs. These drugs, sedative and the hypnotic, is always taken at bedtime at night. It should be always taken. It is not useful in the daytime. That's why the time factor is important. Sedative, hypnotic drugs. For example, you can the benzodiazepines, diazepam. Example, diazepam. It's a common name of diazepam tablet, that neem ki goli. That's called the neem. At night you can take the diazepam pills, tablets, which produce the sleep. always is take at the night, but during the day you can take, does not produce the desired effect. Okay, thank you.